a member of the incident management team, and today the way we're running our community meeting is we have several panelists. They are going to give you an update, and then what we've also done is culled about, I think, over 130 questions that came into us to really pick out the themes that people are asking about. And our panelists are going to take some time to answer your questions, but not before they give you kind of an update on where we're at. So joining me today, and thank you for being here, everyone, is Marky Butler, who's the mayor of Snowmass Village and also the chair of the Board of Public Health. She'll be followed by Karen Kenneman, who is one of the Unified Commanders and also the director of Pitkin County Public Health. And we also have with us today Dave Rustler of Aspen Valley Hospital and Dr. Catherine Bernard. And then we have Gabe Muthing he's another one of our Unified Commanders and also the director of the Aspen Ambulance District. So again, what we're going to do is I'm going to kick it off to each panelist to get us started, and then they're going to go through some of the questions that you brought to us and give you some answers to those questions. So with that said, welcome to the meeting today, and I'm going to go with Marky.
Good afternoon to everyone who is listening today. Before I get started in what I want to say, I want everyone to celebrate National Public Health Week. And most importantly, our team of Karen Kenneman and all of her staff. They're working tirelessly, and I really appreciate all of their hard work. Just a few updates. I think it's very, very important that we continue to drill down on our public health orders. I've had many, many questions from people here in Snowmass Village and also in Aspen about why did we do additional orders to our public health order, our initial one. As you all remember, the initial public health order recommended social distancing 6 feet apart, and then second of that was groups of no more than 10. Also, we're aware that there were some part-time homeowners coming back into our communities, and in the conversations of the second order, more restrictive order, we also addressed that. So let me first give you a few updates. This morning at the RAFTA board meeting, an action was taken for mandatory face coverings for anyone riding RAFTA, and that will go into effect on Monday morning. Likewise, in talking with Karen and law enforcement earlier today and several other members of our board, we will be doing an emergency meeting tomorrow afternoon, and hopefully we'll be issuing an advisory public health order, and that would be in sync with what Linwood Springs did, what RAFTA did this morning, and then that order would come into effect early next week. Now, some of the questions that I get primarily come from the construction and landscaping business. And I clearly understand many people are building homes. There's a lot of construction, commercial construction going on. We got big projects here in Snowmass Village, a lot of homes going up and a lot of repair work done. The answer to that is we are so focused on essential businesses only. And you have to ask yourself, is construction considered an essential business? The answer, from my perspective, and what I tell folks and what I continue to tell all of the construction people that are calling me and other members of our town council, we do not consider construction essential business. So, and the second part of that is the construction industry has many, many, many employees. Many of them have to cross the jurisdictions as they drive to their construction site. Once again, it's another chance for a spread of the virus. So, needless to say, we're very hard and fast on that rule. As it comes into landscaping season, which it is, we haven't fully talked about this yet, but I'm pretty sure we're going to apply the essential business scenario to our landscape people. Another question that I constantly get is about part-time homeowners coming back into our community. And needless to say, I can tell you I probably know at least 10 to 15 families here in Snowmass Village who have come back to their homes, or their children have come out here to stay with them that are from New York City or Los Angeles or San Francisco, but many, many of the hot spots. We did the extension on our public health order they are to go into quarantine for 14 days. That's hard to enforce. I know the airport is passing out information when people land about the 14-day quarantine. Likewise, if you and I decided to go take a trip somewhere and you come back into Snowmass Village, 14 days. So the point of the matter is we want to continue to really depress all of the spread. And I applaud the work of this team that are on the video today. When I look at the number of the cases every morning of who's what's at the hospital, how many new cases, we have surpassed every other county and every other community in terms of holding it down. So I applaud the team, I applaud everyone in the public. Another important issue is how many people in a group? Well, it used to be 10 people. With the expanded orders, we took it down to 5. So no more than 5 with social distancing. In terms of another big question I'm getting, and that's from our local businesses. Needless to say, our restaurants are suffering, our hotels are suffering, many retail stores are suffering as we really limited the number of stores that can be open to, limiting that to essential business. The question is, we already know, and you've seen it in the newspaper, all of our communities are going to be hurting in terms of tourism season, whether it be summer or when we go into fall or even into winter. We're projecting, and I think John Peacock said the other night in December, we hope to be about only 15% down. We're planning 35% down here in Snowmass Village. So we don't really know. The point of the matter is these businesses are not going to come back and be fully robust and seeing a lot of customers as they come back online. And Karen will be talking about some of those issues when she speaks. But the question is, what are we going to do? What is the town government's doing in order to support them? Well, there's a lot the federal government has done, so we'll start there. The CARES Act, the small business loans. Here in our town, we're very, very flexible with those who owe sales tax or any property tax, et cetera. The governor came out the other night with the order on no remittance of sales tax during this period of time. And then as we began to think about other ways we can help our local businesses, we're asking our local businesses to let us know what they need, and we will work with any one of our local businesses. And in talking with my colleague Tori earlier today, and what Aspen is doing, I think you've probably read about potentially about $5 million fund for businesses. I don't know all the details, and neither does he yet, because it's still a topic at City Council, but I applaud all their work in terms of really finding an opportunity to help our small businesses, whether it's a loan with payback or forgiveness. All of those details are yet to be worked out over in Aspen, and we will more than likely look at doing something similar to that here in Snowmass, but not the magnitude of what Aspen has the financial resources to do. So with that said, Karen, did you want to add anything on to what is a face mask? That's the other thing I'm getting. Karen, you want to talk about that a little bit, and then you can move forward.
Sure, yeah, thank you, Marky. Just to do a quick sound check, Tracy, you can hear me okay?
Yeah, and Karen, just remind people who you are. That'd be great.
Sure, yeah, so Karen Kenneman, I'm one of the incident commanders as well as the public health director here in Pitkin County. Good afternoon, everyone. So I'll start in a little bit on the face mask, and then if Marky has anything else to add, and then I'll jump into a little bit more on strategy and our roadmap to the future in addressing the spread of COVID-19 in our community. But yeah, so as far as the face mask go, I think we saw some changing messaging coming from the CDC originally, and now the CDC is recommending some sort of face mask, cloth face mask for the general public, not recommending using surgical masks or N95s in essence to preserve those for first responders in the healthcare system. What we know, what we've learned as we continue to learn about this SARS-CoV-2, the virus that's spreading throughout the country, is that people can be pre-symptomatic or asymptomatic. And So the purpose of wearing a cloth mask is really, first of all, to cover your nose and mouth, and it's to protect others. And so just recognizing that it really is to protect your neighbor. If you are pre-symptomatic or asymptomatic and not knowing that you're sick, again, we're still recommending that people follow all of the other pieces like the stay-at-home order and stay at home if you're sick in any form or fashion. But in case that you do not know that you might be, in essence, having COVID-19, and we know that the virus can shed up to 48 hours before you might be symptomatic with a cough or sneeze or other symptoms. So really what this mask does is it allows you to, again, protect your neighbors and ensure that you are not inadvertently spreading or shedding the virus to other people. As far as the mask goes, we have a video on our website that talks about how to wear a mask. There's a video actually from the Surgeon General there. But it's really important that if you're wearing a mask, that you wear it properly, because it can actually do, in essence, more harm than good if you don't do the proper protocols around it. So I think the most important part is, you don't touch the front of the mask. You don't pull the mask down and have a snack and then pull it back up. That you really want a tightly woven fabric that's close-fitting to your face. And to think of your mask like underwear, that it should be washed after every use. And so to just go forth and look at the video, it tells these guidelines, but to effectively wear a mask is just as important as wearing the mask itself. And so to echo what Marky said, that strongly advising the community to wear a mask when they're out in public. And again, this does not replace social distancing or good hygiene. Those are still most critical to this response. And so we don't want people to have like a false sense of protection that they're protecting other people by wearing a mask, that they still need to do all of those other components of social distancing and good hygiene and all of the pieces that we've been talking about for a few weeks now. So there's the mask piece. And Marky, did you have anything else you wanted to add before I jump into my section?
No, I'm fine. So go ahead, Karen.
Okay, great. So a lot of the questions that came through this week have been around sort of long-term strategy and, where are we going from here? And I think that this is kind of $1 million question, because this is a road we haven't traveled before. And so the map is not a really strong GPS map. We might have some faint outlines of county lines or faint outlines of state lines to have a guidepost, but we don't have the intricate road structure to know how to go from point A to point B. But what we do have are different pieces of data that can be those guideposts. And so I want to talk a little bit about the modeling that's been going on at the through the School of Public Health in Colorado, and sort of what that data is telling us collectively in Colorado, and then what kind of localized data we've been collecting. Talking a little bit about the symptom tracker data that we've had out to the public to report in on, the emotional tracker data, and just kind of talking a lot about these different data pieces. And then I do want to talk about some guidance that has been put forth of like, when do you know it's okay to lift the social distancing strategies, and what needs to be in place in order for those to happen? And so first, I just want to commend the citizenry, the residents of Pitkin County, because like Marky said, what we know is that the social distancing that we put in place through the first public health order is working. And we know that because we don't have a lot of mortality in our community due to COVID-19 illness. We know that because of data indicators at the hospital. We haven't seen a surge there. And so I just want to reiterate that what you all are doing collectively in following the public health order and taking it seriously is making a difference in this community. And I just really want to sincerely thank everyone for that. And also, I think just acknowledging again that I hear that the community is frustrated, and I hear that the community is angry, and they may be really confused. And I think, I feel those same things every day, probably. And I don't blame anyone in this community for having any of those thoughts and feelings, because this is really, truly a place that none of us have been before. And there's nothing really fun about any of this. And so in regard to that, you're doing some really amazing work in obeying the public health order. And I know we say it a lot, but you are truly saving people's lives. You're preserving our healthcare system. And I remember when I did our first community meeting, and I talked about what are our overarching goals. And our overarching goals really haven't shifted. They're to preserve the integrity of the healthcare system. They're to reduce mortality and protect those that are most vulnerable for getting a severe form of this illness or dying from this illness. And they're to ensure that the determinants of health, those things like education and access to food and access to shelter, are still there for people in this community so that we can recover strong. And I believe that all those things are being taken into consideration in every decision that people in this community are making, every decision that the IMT makes, every decision that the Board of Health makes, every decision that a town or the BOCC council or the BOCC or town councils make, and that everybody has that best interest at heart. And how we get there can be a little curvy along the path, and because we're all learning at the same time of how to do this best. But I think the amount of planning for recovery, the amount of social supports that people are getting in this community through the work of ESS6 and donors and the cities and town and the county donating, giving money to support people through this crisis is really incredible. And I just want to really thank everyone in this community again for really rallying to those three goals, because that's what's going to get us through this, is to really keep those goals in mind and to be focused on those as we move forward in all of our responses. So with that, I think there's been some data that's come out from the Institute for Health Metrics and Evaluation, which is a public health data group out of the University of Washington. They were putting out surge numbers, when they expected a surge in Colorado. Those numbers were fluctuating, I think, almost on a daily basis. And that kind of got out, through the national news. It's the data that the federal government has been using. The School of Public Health in Colorado at the same time was modeling out the same predictions. When are we going to see a surge in Colorado? And some other indicators, like the number of ventilators within Colorado, was a more specific and accurate number than what the Institute was using. And so that's why you've seen a flux in the difference between the numbers that came out from the Institute and the numbers that are coming out from the state of Colorado. And if you're more interested in learning about that, the governor did a presentation on that data. There's a link in a press release. I think you could just Google it and you can get a sense of where that modeling data is coming from for the state of Colorado. But that's why you're seeing some of those numbers sort of jump all over, is when the surge is going to happen in Colorado. And the state of Colorado believes that we have not hit the surge yet. And that's why we are still really expressing that people need to tamp down on the social distancing and really take that seriously, because we really haven't hit the surge in the state of Colorado. The types of data that they use to figure that out are, again, the number of ventilators when social distancing started, and they use numbers like traffic data to determine social distancing. So there's a number of indicators that they put into those models. And again, they're mathematical models. They're only as good as kind of the numbers that go into them, but they're using all the best numbers they have right now in real time to predict that surge. So I think more to come on that as we follow the surge data from the state. We're also collecting some localized data to figure out if there are nuances in our region, and those numbers include everything like hospitalizations, the number of healthcare workers who are sick, number of ventilators, the number of mortalities, and we're folding in our symptom tracker data into that as well. For the symptom tracker data right now to date, we're at 293 responses. The most common symptoms reported are fatigue, cough, and headache. We are seeing that there are less reports of symptoms by date, but we don't know if that's just because people aren't reporting now as much, like we're seeing a decline in reporting, or if it's true that we've just seen a decline in number of people exhibiting symptoms in the community. So we're going to have to sort through that data a little bit more. We also had 342 people take the emotional tracker data. And the interesting thing I think here is the majority of people feel like they're really able to follow the social distancing requirements. And that's in line with sort of what we're seeing with the other data. So again, thanks to that. Thank you all to that. What people are having the most trouble with is actually disinfecting surfaces. So just encouraging people to continue, like when I go anywhere beyond my house, I disinfect the table I sit at right away. I disinfect it when I leave. And so just thinking about how do you do more disinfection in your own house, or if you are still in a critical service and you're going to another place to work, to go ahead and disinfect at all times. And people are having a little bit of a hard time staying at home with symptoms. So when you're not feeling well, again, it's really encouraging you to not leave your house at all. Have someone else go do the grocery shopping. So really encouraging people, again, if you have symptoms, do not really leave your house. And then I think the hardest part emotionally for people with the stay-at-home order is that they actually are, not surprisingly, really missing their friends and family and that physical interaction with them. The second thing is people are missing work. They're missing going to work. And then third is like sports and going out to eat and events. So it is interesting to see where people are struggling the most with really this hard place to be of not being able to interact with people we care about. So that's the localized data. That's where we are to date around sort of the modeling, and we'll be following the state modeling data as that comes out more, and that will give us a lot more information about our own peak in our own community, our own surge, and social distancing in relation to that. And the last thing I want to cover is there have been a lot of questions about, well, how do we know when it's okay to lift social distancing? How do we know when those public health orders will be lifted? And the Resolve to Save Lives is an initiative, an institute. It's a global public health institution. The president of it is Dr. Thomas Frieden, who is the former CDC director, and they've put out some indicators. So instead of looking at a timeline of when a surge is and when you might lift based on like timing, and they've really put in place like what are indicators that have to happen within a community to know it's time to lift that suppression. And they have three different buckets that they use. They use epidemiological data, healthcare data, and public health data. And I'm just going to go through these so that the public is aware of what those kind of indicators look like. And these are the kinds of things we'll be looking at, and I'm sure the state of Colorado will be looking at as well. And so this is when measures can be loosened, and it's when all of these criteria are being met. And when we start to talk about loosening the social physical distancing measures, it'll be incremental. So we might look at something like lifting or reopening a school before we're going to look at reducing the requirement to have physical distancing between people be six feet apart. So there's incremental kind of ways that we Gabe says, like meter the social distancing lifting of those restrictions. So from an epidemiological standpoint, we're looking at decreasing cases in context of increasing testing, or stable testing with decreased positivity rates for 14 days, decreasing numbers and proportions of cases not linked to a source case, steady decrease in influenza-like illness and syndromic surveillance for at least 14 days, decline in deaths for 14 days, and decrease in healthcare worker infections such that the infections are now rare. So those are the epidemiological criteria that would have to be met. The healthcare criteria is ability to include staffing to double the number of patients treated in ICU, ability to include staffing to screen large numbers of symptomatic patients, sufficient PPE for all healthcare workers if cases double, sufficient face masks to provide all patients seeking care if cases double, more discharges than admissions in COVID-19, ensure at least baseline capacity in general healthcare services through expansion of telemedicine. Healthcare facilities enforce policies and redesign to minimize possible exposure, triage. So those are the healthcare criteria, and then the public health criteria are all cases interviewed for contact elicitation. Contacts elicited at least 90% of the cases. 100% of symptomatic contacts and others with symptoms undergo testing within 12 hours of identified symptoms. Enough hand sanitizer to place at entry and strategically placed in buildings, including workplaces. Designated facilities for non-hospitalized COVID-affected people who can't be safely cared for at home. Demonstrated ability to convey physical distancing recommendations that change behavior amongst residents. So I hope that gives you a little context of what we'll be looking for in our community and what the state of Colorado will be looking for as far as how do you start to meter up and reduce those physical distancing measures. And again, it will be kind of like a partial reduction. I don't think we'll just lift it wholeheartedly up, but looking at different things that might open sooner than other things. So that's all I have for you today.
Great, Karen, thank you very much. With that, we're going to move the conversation over to Dave Ressler with Aspen Valley Hospital. And again, like last time, Dave, when you're done, I'll have you move it over to Dr. Bernard.
We'll do sound check. Can you hear me okay?
We can hear you great.
Great. So again, I'm Dave Ressler. I'm the CEO at Aspen Valley Hospital. I'm happy to have the opportunity to talk to the community again. We actually received 3 excellent questions that I'm going to speak directly to today that also happen to be the areas that we wanted to address. So I'll take advantage of the good questions that the community is posing. So the first question that I'd like to speak to is, how many patients are currently at AVH with COVID symptoms, and what is the remaining capacity? So back to Karen's point, we are still seeing relatively stable and small numbers of patients presenting for care. Yesterday, for example, we had 3 patients in our respiratory evaluation tent that are referred by our primary care practices. The day before, we had 6. So that's generally the range that we're seeing. We had 2 patients in our emergency department yesterday, and the day before, I think we had 4. We currently have 3 patients admitted with COVID symptoms. And to put that in perspective in terms of our capacity, those 3 patients are in negative pressure rooms. Those are isolation rooms that contain the contaminants within the room by means of air pressure, pushing more air flows into the room than out. And we have 8 total. So we have 3 of 8 rooms currently occupied. But I think it's important to note that we can create more if we need to, which brings me well, actually, before I go to that, I was going to talk about our surge plan and how we create more of those rooms. I'll come back to that in a minute. I did want to comment on our workforce because Karen also brought that up, and that is a very important factor for us and an important objective that we're trying to accomplish as a community, which is to protect that workforce. And we've looked back over our data that was provided to us by our employee health practitioner, And pretty much for the last month, we have ranged between 4 and 7% of our workforce being out with COVID-like symptoms, between 4 and 7%. We have, that equates to about 20, 25 people at any given time on average. That's about what we are, we can live with that, and about half of the people are not in clinical roles and are actually able to work from home. So they're isolating themselves, they're at home until our employee health practitioner allows them to return to work if they need to the hospital. Many don't need to. They're able to continue working from home like everybody else. We only have essential personnel at any given time here at the hospital. So hopefully that gives a little bit of a perspective about what the status is of ABH. Actually, there was one other thing I wanted to add, and that is that we have transferred 4 patients down to a lower altitude and a higher level of care, and you may recognize that number if you're watching these briefings every week. That's the same number we had that I reported last week. We have not had any additional patients, and that is fantastic news, that we have not had any more patients require ventilator support since I last reported. So the next question that I wanted to answer was, can we explain the hospital's surge plan and where people will go if there are no more rooms at ABH or we run out of ventilators? So to answer that question, the surge plan I think I've described a little bit before, but I'll just say again, it actually starts with something that we implemented back. We were one of the first hospitals in early March to postpone all of our elective surgeries and services that don't need to be done, that aren't urgent or emergent. That was the first step, because what that does is that both protects our staff and it frees up all of our resources to be able to deal with either COVID-related patients or obviously emergencies. And I think it's important to point out that every day we are having heart attacks and patients with appendicitis and gallbladder attacks and fractures and a few traumas come to our hospital, and we're here for you. That's what we've always been here for, and we continue to be available for those services. But everything else we've postponed. So now we have all of our resources available for when patients really need us. And the surge plan basically takes into account our beds, our equipment, and our PPE that you've heard so much about. And we've become very creative in its use, and it gets redeployed in ways that meet the demands where they present. So the question was, what do we do if we ultimately, I mentioned before that we have 8 negative pressure rooms, but we actually can bring in air handling equipment into other rooms, and we can create as many as 4 to 6 more if we need to. So we have a fair amount of capacity for negative pressure rooms. Ventilators as well. We typically have 4 ventilators, but because we are not performing elective surgeries, we're able to bring some of our anesthesia machines into use and utilize those as additional ventilators. So we can actually have as many as 8 ventilators. But the real question is, because we don't want to keep ventilated patients here, and if we do run out of space, what do? We transfer them down to a lower altitude, to Denver, to Grand Junction, to be able to get them to a facility that can accommodate their needs, whether it's because they are better off down there for the level of care that they require or because we have run out of capacity here. Really important point, though, we need to make sure that those facilities maintain capacity. So that's why we are so pleased with the governor's actions and the statewide efforts to suppress the curve as well, because we need those facilities available for patients that need to be transferred there for additional services. So hopefully that explains a little bit better that in addition to those measures, our surge plan is very comprehensive, and it would take a long time to go through all of it. It has protocols in place. We do things differently is the simplest way to look at it, when we are in a surge mode that we're all trying to avoid. So I hope that helps speak to that question. Then the final question is really a great one that we were looking forward to discussing, and it's related to testing. And the question is, many experts are saying that early intervention and testing make a difference in people's recovery. What is the criteria needed to get tested, And why are so many people who are ill being told not to go to the ER for help? Let me take the last part of that question first. We are not saying that people should not come to the ER for help. Absolutely not. If you have critical needs, if you feel like you are in distress and you are concerned about your health, our emergency department is here and available. So that should absolutely not be the message. If your symptoms are minor to moderate, then contact your primary care physician. You don't need an emergency department. It's up to you to decide. But if you don't need an emergency department, contact your primary care physician. They will direct you to stay at home, maybe recommend some over-the-counter medications or what have you to help manage your symptoms, or they may recommend that you come to our respiratory evaluation tent, where our physician and team there will further evaluate you, and they may refer you on to the emergency department themselves if you need it. But I want to absolutely make clear, as we did last week, we are here to take care of you in the community. So back to the question about testing. I first want to clarify that there are really two types of testing, and they often get confused. The first type of testing is community testing, and I believe Gabe Muthing is going to speak to that question. That's broad-based testing for epidemiological purposes to track and try to manage the spread of the virus. That is very different than the kind of testing that we are doing and have been doing all along at Aspen Valley Hospital, which we call medical testing. The medical testing is for the explicit purpose of managing the condition of the patient. That's what we utilize medical testing for. And on that note, I should say that it is our physicians at Aspen Valley Hospital that have been involved every step of the way in defining what testing we should be doing and when and for what patients. And there's good news on this front. Brand new news. Within the past week, there has been an increase in the capacity of testing that you've been hearing about all across the country, and in every community in the country, there has been a lack of availability of testing, so we had only been prioritizing those patients that we had hospitalized and certain healthcare workers that we needed to test. The good news is now that commercial labs have come online and have expanded the availability of testing, and in addition to that, there have been new tests that have been able to get through the FDA expedited approval process and are now coming to the market. And I am not exaggerating when I say this. Every day there are new tests and there are new developments that we are tracking very closely with our physicians and looking to see which of those tests are most helpful to our patients. There are basically two types of tests. One is the swab-based test, the PCR test that we've mostly been talking about all along, to get sent off to a lab and have some kind of a turnaround time, depending on the lab we send it to. 2 days, 4 days. We had up to 2 weeks just a couple weeks ago. So they can be helpful depending on the turnaround time. The other type of test that's relatively new is called an antibody test. An antibody test, unlike the first test that's really looking for the presence of the virus in your mucus, the second type of test is looking for your body's production of antibodies to fight the virus. And those antibodies are in your blood. And so the antibody test uses a drop of blood and then looks in the blood to see if there are antibodies there that are suggestive that you have the COVID virus. And the advantage of the antibody test is they can be done rapidly, called point of care. We can do it right here, get the results right away. And we now have those tests in-house. There are different advantages and disadvantages that I'm not going to get into today because that's the role of physicians to talk through when and where you use each of them, and they are doing that as we speak. A team of physicians are defining the criteria to answer your question about when each type of test is best utilized, and they can often be complementary in nature because for example, the antibody test will not be positive typically for at least 7 days, and even then it's questionable for a few more days after that. You get a lot of false negatives. So they have to be very thoughtful and specific about when they use the tests. So that is the process that's underway right now. Is for the criteria is being developed, And at the same time, we are, with these new tests I just mentioned, the antibody tests, our laboratory first has to validate them. They have to go through a process of correlation studies to make sure that they understand the the accuracy of the test in terms of two things. One is their specificity, making sure that you're testing for the right antibody, and the second is whether or not they are having false negatives or sensitivity. So specificity and sensitivity. They're doing that validation process right now. That's going to take a few more days, at least, perhaps a week, just to make sure that our physicians can count on the reliability of the test. And in the meantime, as I mentioned now several times, the physicians are developing the criteria. But the criteria are going to focus on those patients that need it and for whom the tests are beneficial. And those patients are going to be patients with moderate to severe symptoms, like those that would be referred to our respiratory tent or emergency department, and those patients that have risk factors, so that they might have comorbid conditions that would contribute to them being more susceptible to the illness. So those are what we're going to let our physicians define more fully. So that, I hope, answers the availability of tests and the question that was asked. And I am now going to turn it over to our Chief of Staff, Dr. Catherine Bernard, to provide our physician's perspective and answer some additional questions. Thanks again for your time.
Dr. Bernard, can you hear us okay?
I can hear you. Can you hear me?
We can. We hear you loud and clear.
Okay, great. So I just want to say, Dave, great job. You kind of said it all already. There does need to maintain in our minds the difference between the testing of the community and the testing medically of patients in the hospital. But I think you covered that pretty well. I have a couple questions in front of me that I was supposed to cover, and Dave, I think maybe you have covered them too, but the first one was, what should people do if they have symptoms they can't manage at home? And Dave already said it, call your doctor or come to the ER. I'm in the ER, or one of us is, and we have procedures in place that make it safe for COVID and non-COVID patients. Dave mentioned we're seeing 1 or 2 COVID patients a day. I admitted one yesterday. I sent one home today on oxygen. You know, we are seeing patients with COVID in the ER. I'm also sewing up cuts and taking care of heart attacks and sending people for emergent surgery. So we are still open. We do want to see you if you are sick. If you have minimal symptoms and can manage them at home, we are asking that you try to do that, because as we are talking about limited resources, you know, we talk about masks, we talk about gowns, we also are talking about doctors and EMTs and the people that you need to care for you when you are very sick. You know, we're trying to manage those resources too. So just to be clear, we are open. We want to see you in the ER if you're sick and you can't manage at home, and we will be careful about it and try to manage our limited resources effectively. The other question I had was, how can the community help support what AVH is doing? And Karen covered this, and I think I covered it last week as well, but I'm going to say it again. You are doing it. Thank you so much. I have a mask to wear. I have multiple sets of gloves, and I have rooms available and safe for the patients who are presenting, and that is the #1 goal of the IMT, is to keep the hospital working so we can take care of the patients who need us, and we've done it. Thanks to you guys. Thank you again. There's another part of that question. It is, about masks and gloves. Somebody wanted me to talk about masks and gloves. And, I'm sorry, I didn't introduce myself. I am the Chief of Staff. I'm also a practicing ER doctor. I'm also a proud member of the Snowmass Village community. And I get asked these questions on a daily basis when I see people, because I don't wear a doctor mask to the grocery. I don't wear gloves. I wear my neck covering that I wear when I ski, and I cover myself. And I try not to touch my face, and I try not to touch anything when I get home without washing my hands. And that's what I do. And honestly, that's better than a glove, because if you touch your hands with a glove, or you touch your face with a glove, that's just as bad. Now, some of my friends say to me, well, Catherine, but when I'm wearing a glove, I notice that I touch my face. Okay, great. If you're training yourself, that's fine. But the real key still is don't touch your face. So hard to do. I think that's all for me. I think that's it.
Great.
Thank you so much.
Thank you, Dr.
We're
Bernard.
here in the ER.
Perfect. Thank you so much. We are going to move it over to Gabe Muthing. You're going to really start to kind of close this out, Gabe, on the testing conversation. And then I just have a few closing comments, and we'll go from there.
Well, it sounds great. I'm glad to speak with everybody today. I think I probably have one of the most difficult jobs here today, and that's to really discuss testing, because it is such a complex discussion, and we've done our best to try and get that information out there, but it's very, very complex. So we'll just start off with just about the tests themselves. Dave Russler did an amazing job of telling you the difference between a PCR test and an antibody test, and how those are utilized both in the hospital from a medical standpoint and then from an epidemiological standpoint out in the community-based testing. I will tell you that, as Dave said, there are tons of tests coming on the market right now, but availability is still the key. We still have to be able to get them. And so those tests, as they come out, we're starting to get the information about them long before we actually have the test available. So we have a fantastic group here made up of physicians and epidemiologists that allow us to be able to vet those tests and evaluate them on their positives and their negatives. As Dave mentioned, we evaluate them on their sensitivity and their specificity. And we're really looking for a test that will fit our needs and fit our community well. It's important to note that all of them have limitations. They all have positives. They all have negatives. We are, with our process of evaluating, with our process of vetting those tests, our goal is to find the one that's going to fit well. Now, it is important to note, a lot of people will come up and say, I'm hearing one that the FDA has approved. And in reality, what we're talking about is what's called an emergency use authorization. And that emergency use authorization allows a company to get a test out into the market before it has a significant amount of research behind it. And it's really important to note that we're only 4 months into this disease, so getting those tests out is important. And it's important to get them out into the community, long before most tests that we see have a huge amount of research behind them. But we want to get these out there and get the information out as best we can. We seem to get a lot of questions about San Miguel County, Telluride, and some of the testing that they've done. And we've talked about that before, that the testing that they have done is based around a company doing a research project. And that research project was again, to try and find a test that they could put into a format that everybody could have access to. The test itself, the research that they were doing, was very large scale. Their goal was to test the bulk of their community, and it was very, very cumbersome for them. Certainly involved a lot of personal protective equipment, a lot of personnel, just a huge amount of resources to have that done. As we found out here just recently, there was a report in the Denver Post. It's a well-written article, but essentially that their testing has been halted at this time because of how cumbersome it was and how difficult it was to run the test. So, a huge amount of effort on San Miguel's part for a test that at this point, doesn't appear that it's working well. We'll see as they work through the issues how that comes out. But ultimately, we applaud San Miguel for taking that on, right? They were taking it on to hopefully help all of us to be able to have a test eventually. but certainly it was cumbersome. So for us, when we're vetting a test, what we are really looking for, we are looking for a safe test, one that we know that we can get into the hands of the community, that is going to be safe for them to take, and safe for physicians and doctors' offices and hospitals to give, that we can do it with the least amount of PPE or personal protective equipment as necessary. We want that test to be effective. It certainly needs to be accurate, or as accurate as we can possibly get. And again, back to my earlier comments, there is no test that is perfect, right? All of them have limitations. But we wanted to find one that was most effective for our community. And last, and what's very important for us, is we want this test to be affordable for all. And it's very important to us, in the healthcare community that there's equity in healthcare. And we want to make sure that everyone has the healthcare, that has healthcare and testing available to them. We want everybody to have access to this, regardless of your ability to pay. So we wanted a test that we could provide free to everyone in our community. And I'm going to say that again. We wanted a test that we could be able to provide free to anyone in our community. So with that, I'm going to conclude today's event with some fantastic news. As of 1 p.m. today, just a couple hours ago now, we received tests. So we now have tests. We have 1,000 tests in our possession. And we are very, very excited to receive those today. It is just a great thing for us. We've worked really hard and long to be able to, as I said, to vet testing, and then obviously to get it and make it available to us. We did receive delivery of the A2 antibody test. That's the test that we have been talking about for some time. And it's also a test that is available to our community for free. As I said, it was really important to all of us, really important to from our elected officials, that was something that we could have, and so we've done it. We now have this test, and it will be free to all those that fit into the criteria to take it. Now, in the next few days, it's really important to note that we partnered with AVH, Madison Valley Hospital, and as Dave Ressler mentioned earlier, to validate those tests. So we still have a bit of a process to go through until we are able to release those out into the public and be able to utilize them for their purpose. So it will take a little bit of time to validate those and put the process in place so that we can get them out there. So the next questions that come up are really, how do we intend to use this test? It is important to note it is the antibody test, as Dave had mentioned earlier. That antibody test, again, measures the antibodies in the blood and allows us to determine if the person either actively has the infection or has recovered from it and now has antibodies that are continuing to look out for the virus and continue to fight it. As Dave mentioned, it is really a test that we see the most accuracy out of it when somebody is 7 to 10 or 7 to 14 days post start of their infection. So there is a window of testing that we have here that we'd like to enact, and we'll get back to everybody on exactly how we'll put people in those categories to be able to get the test and roll it out into the community. So our goal with this test, though, of course, is remember the PCR test, some of the more rapid tests that the hospital will be using to help guide their treatment, the medical tests. Those are specifically for medical. This test will allow us to get the epidemiological data that we've been looking for. It'll hopefully allow us to have a glimpse into the levels of possible immunity in our area. Now, it would take a huge amount of testing to be able to define that or to definitively say that we have immunity in our area. But these amount of tests that we have and the type of tests we have will at least allow us a glimpse into whether or not we have the start of immunity in our area. Now, again, how are we going to use this? It's really as a data point, again, for epidemiological data. We'll put that in our formulas that we have, just a huge amount of data coming from our community in symptom trackers and the hospital data, capacity data. We're going to put this in concert with all of those, and then that'll help us with our modeling moving forward. As Karen mentioned in the beginning, one of our goals here is to see if we can't meter that public health order and meter our suppression efforts so that we can start to get back to normal here. This test is just a start of that. It is not the silver bullet that's going to take away the public health order tomorrow. This is just the start of the data that we need to be able to meter that public health order and our suppression efforts. So, again, just a start. I want to make that very clear to everyone that this, just because we have this test doesn't mean the public health order will be lifted next week. So, and again, I just want to put in there, it's important to note this test is not a medical test. This is for gathering of epidemiological data, but it will give us that glimpse that we're looking for. With that, I'll leave it there with the testing. Again, we're very excited to have received these today. It was an unexpected surprise for us to see those show up, and we're certainly excited to let you know about it as soon as we found out as well. It was rather fortuitous that we had this meeting already planned for today. So, again, very excited about that. Please look forward in the next few days and weeks as we build the process and validate this test and to get it out in the community. So we will keep you updated as often as we can to let you know when that will be available. Please keep looking at the sites that we have available to you. PitkinCounty.com is a great place to go. We'll continue to put information on there. Our Joint Information Center continues to put information up there and update it daily. Please continue to look at that, and we'll get this test out to the community. Again, thank you for all your support in this, and thank you for bearing with us. We realize it's been a difficult process waiting for something like this to come. And again, we're excited to be able to help the community out with it. So with that, I'll close, and Tracy, back to you.
Great, Gabe, thank you for that update. Something I failed to do in the past is thank Amy with Grassroots TV and Andrew with the Pitkin County Tech Team, who makes these community meetings happen for us each week. So thank you to you guys for showing up and consistently helping get us on the air. I know that for next week, what we're planning on doing is moving towards a public meeting that's a look inside to what the Public Health Board is going to be talking about next week. So more information about that will be coming to you. Can you put that slide up for us, Andrew? And then just, again, to close on today, and I'm sorry my radio audience won't get to hear this, but we do have what you'll start to see on our website and in our social channels, all the places you can go for information about what the team, what the city, what the county, really just our entire community is trying to do to provide information to you as much as we get it and as quickly as we get it. So again, thank you for your time today and for tuning in, and we'll look forward to talking to you again next week.